Tracking your steps or counting your heartbeats is a straightforward matter of recording impacts and rhythms, but your blood pressure represents a far more complex internal force. When that green sensor flashes against your wrist, it is attempting to translate light into pressure from the outside looking in. Because a smartwatch delivers a crisp digital number on a high-resolution screen, we naturally assume it is performing a physical measurement. A reading of 120/80 appears medically precise, leading us to trust the output as much as the device on a doctor's desk. But the watch is essentially looking at a reflection. These optical sensors detect patterns in your blood flow, but they have no way to feel the actual mechanical force pushing against your artery walls. To produce a clinically meaningful measurement, a device requires three specific components: a direct connection to the artery, a reliable anchor, and the proper context. Most consumer wearables currently operate without all three. Treating a mathematical estimation as if it were a validated measurement creates a silent risk. It leads users to adjust their own medications or ignore the signs of a cardiovascular emergency based on an algorithm rather than their actual physiology. The first missing piece is the artery. A traditional monitor physically occludes your brachial artery by inflating a cuff. As air is released, the device directly records the mechanical force of blood pushing back. Smartwatches use photoplethysmography, or PPG. Instead of squeezing an artery, the watch relies on light scattering through the tiny capillaries near the surface of your skin. It tracks how the volume of blood in your tissue changes, but it never interacts with the deep arterial pressure. This makes the optical signal a proxy, a shadow cast on a wall. Your skin tone, your hydration levels, and the stiffness of your blood vessels all determine how that shadow looks. If any of those variables shift, it warps the signal before the watch can even begin its calculation. Because the watch reads light reflection rather than physical force, it cannot determine your blood pressure on its own. It needs a starting point. That brings us to the second missing piece, the anchor. To make sense of the light signals, these watches require manual calibration. You have to take a reading with a traditional cuff and enter that number into the app to give the software a baseline. This introduces a vulnerability called regression to the mean. Clinical evaluations show that these algorithms tend to pull your daily results back toward that original calibration number. They often overestimate your pressure when it is low and underestimate it when it is high. This results in divergence decay. As your actual blood pressure fluctuates away from the conditions of your calibration day, the watch's accuracy drops. The software is effectively guessing based on how you looked weeks ago. Manufacturer documentation confirms these mathematical limits. This specific measurement range shows that the software is blind to extremes. If you experience a severe hypertensive spike or a dangerous drop in pressure, the algorithm cannot calculate values outside these narrow boundaries. Relying on an old calibration means the watch is providing a forecast based on yesterday's weather. The number you see is a reflection of your history, not necessarily your current state. The final missing piece is context. A medical-grade reading requires you to be still, rested, and in a specific posture. A wearable device, however, attempts to track your blood pressure through the chaotic noise of your daily life. This diagram illustrates why context matters. A reading of 130/85 is a normal response while you are walking upstairs, but that same number could be a warning sign if it occurs while you are sitting quietly or asleep. The watch also struggles with underlying health conditions. This list of contraindications includes arrhythmias, diabetes, and heart failure, situations where blood flow patterns change so much that the optical sensor cannot extract a stable signal. Even your environment plays a role. These operating conditions for temperature and humidity are critical because heat and cold change how your peripheral blood vessels behave, distorting the calculations. The watch sees a cardiovascular signal, but it has no way of knowing if that signal is a normal response to your environment or a sign of an underlying medical problem. To use this technology safely, we have to distinguish between marketing and medicine. FDA clearance often just means a device is technologically similar to one already on the market. It is not the same as clinical validation, where a device is proven accurate against international standards in a controlled trial. We map health data onto a hierarchy of trust. This spectrum moves from general awareness on the left to validated medical evidence on the right. Smartwatches fall under directional awareness, while upper arm cuffs remain the standard for medical decisions. Use your watch for curiosity and to spot long-term patterns. But if a reading seems important, always confirm it with a validated cuff and professional guidance. A smartwatch can see the signal, but it still takes a proper, validated measurement to understand the situation.